Hi, I'm Dr. Christine West. I wanted to give you some information about rapid maxillary expansion. So there's a lot of talk about it these days, especially with people with airway issues or snoring and such. And I want to touch on a few things about when do we do it for younger people. So first of all, you might hear that maxillary expansion or expanders are barbaric, and I wanted to let you know that that's really not the case. So my experience is that I taught this early treatment that incorporates expanders when necessary for 25 years at the University of Michigan. And I also trained with the guru of this early treatment and maxillary expanders, Dr. Jim McNamara, for 10 years when I first got out of school. So I have some experience in this area. When we need maxillary expansion, it is usually because of a couple things. One, there could be a posterior back tooth crossbite. There can be a lot of crowding in the upper jaw. Third thing, sometimes we do have very severe constriction of the upper jaw with accompanied breathing issues. When it comes to airway, the standard of care for pediatric patients who have a pediatric sleep apnea or a range of issues in that realm, the standard of care is usually tonsils and adenoids removed, followed by a rapid maxillary expander. So that is a standard of care across medical, dental, orthodontic treatment. The other thing I wanted to point out is that when we do a rapid maxillary expander, and we say the word rapid because it's not like instantaneous, but it happens rapidly over the course of about a month to a month and a half, and we turn just the expander about a quarter turn a day, which is maybe about a quarter of a millimeter. So I always liken it to the thickness of a sheet of paper. Super easy to do. And with little people, we use a little expander. So back in the day when I expanded my daughter, we only had the big, honking big expanders that we had to use, and she did great with it. But now for little people, we use very tiny ones, and it's extremely comfortable. So when people have constriction of that upper jaw and it's a skeletal problem, you have to address it as a skeletal correction. And when we talk about the position of teeth, and I won't get too far down the road here, but there's two types of forces that we can deliver. One is an orthodontic force, which moves teeth only, and that's a very light force, such that if you put a feather next to a tooth and left it there long enough, it would move the tooth, so super light forces. But if we need to move bones or change the shape of a bone, we have to have a little stronger force that doesn't move teeth, but only moves the bone itself. And again, we can deliver that in a gentle force, but only a maxillary expander can do that, not braces. So the other thing too, there's some aligner systems that are offering expanders and so on, and even just early treatment with aligners. And that's fine in some instances, but it doesn't necessarily address a skeletal problem. And the research has not come out in detail on the aligner systems with expansion, but I'm not going to experiment with my patients until I know that the data backs up the claims from different companies. So in some cases we can move teeth only, but in some cases we need to actually address the foundation. It's like building a house. We need a solid foundation to build a house on. We need a solid skeletal structure to build the proper bite and tooth position on. That's pretty much the scoop on maxillary expansion. It's very comfortable. We make sure it's easy on patients, but when it's necessary, it's really the way to go. So when we need a skeletal correction, we need to use a maxillary expander. If we only need to move teeth, then we don't necessarily have to use a maxillary expander. We can use braces or aligner systems and so on. And again, the way I treat patients is if they don't need something, I'm not going to do it just for the sake of doing it. So I'll do what's best. In my practice, I would never treat anybody with anything that I wouldn't use on my own family members. And I have expanded my children when they were younger with expanders, and I've used all different systems, and like I said, we would not do anything that I wouldn't feel comfortable doing. So that's the scoop. I hope this was helpful information for you, and if you have any questions about anything, reach out to the office and we can chat anytime. Have a great day.